आपके लिए एक नई इन्फॉर्मेटिव वीडियो लेके हाजिर हूँ। उम्मीद करता हूँ आपको पसंद आएगी।
Common mistakes that lead to back pain. Back pain can be caused by a variety of factors, and making certain mistakes can contribute to its development or exacerbation. Here are some common mistakes that can lead to back pain. 1. Poor posture, slouching, hunching over, or maintaining an unnatural posture for extended periods can strain the muscles and ligaments of the back, leading to pain over time. 2. Lifting incorrectly. Lifting heavy objects using your back instead of your legs and core muscles can place undue stress on the spine, leading to strains or even herniated discs. 3. Sedentary lifestyle. Prolonged periods of sitting or inactivity can weaken the back muscles and contribute to pain. Regular movement and exercise are important for maintaining back health. 4. Excessive weight. Carrying excess body weight, especially around the abdomen, can shift your center of gravity and strain the muscles and structures of the back. 5. Overexertion. Overdoing physical activities without proper warm-up, stretching, or conditioning can strain muscles and cause back pain. Gradually increasing intensity and using proper form is important. 6. Inadequate core strength. Weak core muscles can lead to poor spine stability and posture, increasing the risk of back pain. Strengthening your core can help support your back. 7. Improper footwear. Wearing shoes without proper arch support or cushioning can affect your spinal alignment and lead to back pain. 8. Sleeping position and mattress. Sleeping on an unsupportive mattress or adopting poor sleeping positions can strain the back. It's important to choose a mattress that provides proper support and find a comfortable sleeping position. 9. Stress and emotional factors. Chronic stress and anxiety can lead to muscle tension, including in the back. This tension can contribute to back pain over time. 10. Smoking. Smoking can restrict blood flow to the spinal discs, impairing their ability to function properly and increasing the risk of back pain. 11. Ignoring pain. Ignoring early signs of discomfort or pain can lead to more serious issues over time. Addressing pain promptly and seeking medical advice if needed is important. 12. Improper workstation setup. Poor ergonomics at your desk or workspace can lead to strain on the back and neck. A well-designed workstation with proper chair and monitor height is essential. 13. Heavy bags. Carrying heavy bags, such as backpacks or purses, on one shoulder can lead to uneven weight distribution and strain on the back muscles. 14. Ignoring flexibility and mobility. Neglecting flexibility and mobility exercises can lead to stiffness in the back and reduced range of motion. 15. Ignoring medical conditions. Certain medical conditions, like scoliosis or osteoporosis, can predispose individuals to back pain. It's important to manage these conditions under medical supervision. Remember that everyone's body is unique, so what causes back pain for one person may not be the same for another. If you're experiencing persistent or severe back pain, it's advisable to consult a healthcare professional for an accurate diagnosis and appropriate treatment recommendations. Precaution for back pain. Taking preventive measures can help reduce the risk of developing back pain or minimize its severity. Here are some precautions you can take to maintain a healthy back. 1. Maintain good posture. Whether sitting, standing, or walking, try to maintain a neutral spine alignment. Use ergonomic chairs and maintain proper workstation setup to support good posture. 2. Stay active. Engage in regular physical activity to keep your back muscles strong and flexible. Focus on exercises that strengthen the core, back, and abdominal muscles. 3. Warm up and stretch. Before engaging in physical activities or exercise, warm up your muscles with light movements and then stretch to improve flexibility and reduce the risk of strains. 4. Lift properly. When lifting heavy objects, bend your knees and hips while keeping your back straight. Use the strength of your legs and core muscles to lift, rather than relying solely on your back. 5. Maintain healthy weight. Achieving and maintaining a healthy weight reduces the strain on your back and supports overall spinal health. 6. Choose supportive footwear. Wear comfortable shoes with proper arch support and cushioning to promote proper alignment from the feet up. 7. Use ergonomic furniture. If you work at a desk, invest in an ergonomic chair and adjust your workstation to promote good posture. 8. Practice stress management. Stress and tension can contribute to back pain. Engage in relaxation techniques such as deep breathing, meditation, or yoga to manage stress. 9. Stay hydrated. Proper hydration supports spinal discs and joint health. Drink enough water throughout the day. 10. Maintain healthy sleep habits. Sleep on a mattress that provides adequate support for your spine and adopt a comfortable sleeping position. 11. Avoid prolonged sitting. If your job involves sitting for long periods, take breaks to stand, stretch, and move around. Consider using a standing desk or taking short walks. 12. Engage in low-impact exercises. Activities like swimming, walking, or cycling can help improve cardiovascular fitness and promote back health without putting excessive strain on the spine. 13. Practice good body mechanics. Be conscious of your movements throughout the day. Avoid sudden twisting or bending motions that can strain the back. 14. Stay hygiene conscious. When performing household chores like lifting and cleaning, use proper body mechanics and avoid repetitive movements that can strain your back. 15. Stay informed. Educate yourself about proper body mechanics and practices to avoid common mistakes that lead to back pain. 16. Stay cautious when trying new activities. If you're trying a new physical activity or exercise, start slowly and gradually increase intensity to allow your body to adapt. 17. Regular checkups. Visit a healthcare professional for routine checkups to monitor your spine health and address any issues early on. Remember that individual needs vary, so it's important to find a combination of precautions that work best for you. If you're experiencing persistent or severe back pain, seek medical advice to determine the underlying cause and receive appropriate treatment recommendations. Treatment of back pain. The treatment of back pain depends on its underlying cause, severity, and duration. It's important to consult a healthcare professional for an accurate diagnosis and personalized treatment plan. Here are some general treatment approaches that might be recommended. 1. Rest and activity modification. For acute back pain, a short period of rest followed by gradually increasing physical activity might be advised. Avoid prolonged bed rest, as it can weaken muscles and exacerbate pain. 2. Pain medications. Over-the-counter pain relievers may help manage pain and reduce inflammation. Prescription medications might be considered for more severe pain. 3. Physical therapy. A physical therapist can design a personalized exercise program to strengthen muscles, improve flexibility, and enhance posture. They can also provide techniques for pain relief, such as manual therapy or therapeutic modalities. 4. Heat and cold therapy. Applying heat packs or cold packs to the affected area can help alleviate pain and reduce inflammation. Cold therapy is usually more effective during the acute phase, while heat therapy can provide relief for chronic pain. 5. Exercise and stretching. Engaging in regular low-impact exercises and stretches that target the back, core, and surrounding muscles can improve flexibility and reduce pain. 6. Lifestyle modifications. Adopting healthy lifestyle habits, such as maintaining a healthy weight, staying hydrated, and managing stress, can contribute to overall back health. 7. Ergonomic changes. Adjusting your workstation, using ergonomic furniture, and practicing proper posture can help alleviate back pain caused by poor sitting habits. 8. Manual therapy. Chiropractic care, osteopathic manipulation, and massage therapy can provide relief by addressing spinal alignment and muscle tension. 9. Cognitive behavioral therapy, CBT. For chronic back pain, CBT can help individuals manage pain by changing negative thought patterns and behaviors related to pain. 10. Injections. In some cases, corticosteroid injections into the affected area can provide temporary relief by reducing inflammation and pain. 11. Acupuncture. Some people find relief from back pain through acupuncture, which involves inserting thin needles into specific points on the body. 12. Surgery. Surgery is usually considered when conservative treatments have not provided relief and the pain is associated with structural issues like herniated discs, spinal stenosis, or certain spinal deformities. 13. Alternative therapies. Techniques like yoga, Pilates, Tai Chi, and water therapy can help improve flexibility, posture, and muscle strength. 14. Prescription medications. For severe cases, a healthcare provider might prescribe muscle relaxants, stronger pain medications, or nerve pain medications. 15. Mind-body techniques. Meditation, mindfulness, and relaxation techniques can help manage pain perception and reduce stress, which may contribute to back pain. It's important to note that treatment plans should be tailored to the individual's specific condition and needs. If you're experiencing back pain, it's recommended to seek medical advice to determine the most appropriate treatment approach for your situation. Conclusion. In conclusion, understanding and addressing common mistakes that lead to back pain is crucial for maintaining a healthy spine and overall well-being. By avoiding these mistakes, individuals can significantly reduce their risk of developing back pain and related discomfort. Remember that maintaining good posture, practicing regular exercise, lifting objects correctly, and prioritizing ergonomics in both daily activities and work environments are essential steps to prevent back pain. Medical information disclaimer. This video contains general medical information. The information in this video is only for educational purposes. The medical information is not advice and should not be treated as such. You must not rely on the information in our videos as an alternative to medical advice from your doctor or other professional healthcare provider. My channel Health Tips by Shah Ji provides valuable information on how to stay healthy and fit. You can learn about the latest health trends and tips to help you stay healthy. Health Tips by Shah Ji is the perfect resource for anyone looking to improve their overall health and well-being.